Hey guys, I wanted to make an informative video about bonded retainers and explain some things about them. So what are bonded retainers? Bonded retainers are bonded wires that are placed on the lingual surface of the teeth, of the front teeth, of the upper and lower jaw. In this case, we have a bonded retainer that is also gold plated. Yeah. And the material used is either stainless steel or titanium. For patients that usually or often get an MRI, it's preferable to use titanium as it produces lesser artifacts than stainless steel. A very common question is, how long do I need my retainers? So after an orthodontic treatment, we bond the retainer to stabilize the situation of the teeth, stabilize the position of the teeth. And after that, they have to remain until the 30th year, because until then the teeth movement is significant, and after the 30th year the teeth movement persists, but in a lesser extent. So what many people don't know is that teeth move, they shift during a lifetime. And that's not only in patients that had an orthodontic treatment. Teeth move and shift even if you didn't have previously an orthodontic treatment. So what are the pros and cons with bonded retainers? The pros are that you don't have to remember to put them in, they're fixed and always with you. The cons are that it is much harder to clean them and to clean the teeth. So that's a big disadvantage with bonded retainers. It's much easier with removable retainers than with bonded. So what can happen with bonded retainers are two things. Case studies show that in some cases teeth movement can persist even with a bonded retainer. So what some orthodontists or dentists will do is give the patient a night guard or a removable retainer on top of the fixed retainer, so the teeth are hold it in place. So the other thing that can happen is an X effect or a twist effect. What these effects are, I will put in an image to show you the movement. It's usually a movement of the root, either to the buccal or lingual side, and it's not really understandable why this happens. There are many theories, but none of them are really established. So how the retainer is made may be interesting fact is the retainer is usually bent by the technician or by the dentist. It can be bent chair side or in the laboratory, and there are also machines that can bend this wire. So like I said, the retainer has to stay a long time in the mouth of the patient, and in that time, in that period, a glue point. It can break off after eating something hard, for example, and usually it's easy fixable with a new bonding of the tooth. In a case where the retainer is broken, it depends where it's broken. If, for example, the retainer is broken between the canine and lateral incisors, some dentists or orthodontists will just remove the retainer in the spot that is broken off, and other orthodontists will remove the whole retainer. If the retainer is broken between the incisors, it has to be replaced. So thank you for watching. I think I covered everything. I'm not sure, but if you have any questions, you can leave a comment and I will take the time to answer. Thank you.